Hey everyone, and welcome. So, you're here because you're getting ready for your 2-day practical assessment with Paul from the First Aid Garage. First off, great job getting through all that online material. Think of this as a fun, quick run through to get you feeling super confident and to make sure those skills are ready to go. So, you ready for this? We're going to do a quick review of the key practical skills you'll need to show off. We'll hit the big ones: head and spinal injuries, then chest emergencies, that's your choking and CPR, and finally anaphylaxis. Let's think of this as our final mental warm-up, all right? Just to make sure you walk in there feeling totally ready. First up, head and spinal injuries. Now, you might wonder why we lumped these two together. Well, it's for a really critical reason. A bad head injury often comes with a neck or spinal injury. Paul is going to be looking to see that you're careful, that you're deliberate. Your number one job above all else is to not make things worse. Simple as that. Okay, let's break down what you're seeing here, because spotting the difference is absolutely key for your practical. With a concussion, you might see dizziness, nausea, maybe they were briefly knocked out. But a skull fracture? That's a whole different level. We're talking really specific signs like a wound, maybe the skull feels different, or you see bruising. And if you see clear fluid coming from the ears or nose, that's a huge red flag. That's actually cerebral spinal fluid. And knowing these signs tells you exactly what you need to do next. Okay, this right here, this is the golden rule. If you walk away with just one thing about head injuries, let it be this. If you even think it might be a skull fracture, you absolutely do not move the head, period. Protecting that spine is your entire job in that moment. Paul will 100% be watching for this. It's that important. So, what does this look like in practice? What are you actually going to do? Step 1, obviously, call 999. Then, and this is key, you don't move them. You're going to have to show something called manual inline immobilization. It sounds technical, but it just means you're gently holding their head and neck to keep it all stable. And here's a pro tip for your assessment. Ask questions they can answer with words, not with a nod or a head shake. That's a really smart way to keep them still. All right, let's move on to our next section, chest emergencies. For your assessment, this is all about acting fast when the clock is ticking. We're talking about two major things: handling a choking child or infant, and then knowing exactly what to do if they become unconscious. And you guessed it, that means CPR. Okay, so you've got a choking situation. The very first thing you do is a super quick assessment. Is it mild or severe? If you can hear them coughing or they're trying to speak or cry, that's actually a good sign. It's mild. Your job? Just encourage them to keep coughing. But what if they're silent, can't cough, or worse, you see their skin starting to turn a bit blue or gray? That's severe, and that's your signal to jump in and act now. Okay, let's talk about infants, so babies under 1 year old. You've got to know this sequence by heart. First, shout for help. Then, it's up to 5 really sharp back blows, right between the shoulder blades. Check if it worked. If not, you're going to carefully turn them over, supporting their head, and give up to 5 chest thrusts with 2 fingers right in the center of their chest. And you just keep going, a cycle of 5 back blows, then 5 chest thrusts, until that blockage is out. All right, now for a child, so anyone over 1 year old. The process changes a bit, and this difference is super important. You still start with encouraging them to cough, and then up to 5 back blows. But, and here's the big change, if that doesn't clear it, you move to abdominal thrusts. You know, the Heimlich maneuver, not chest thrusts. Paul is definitely going to be watching to see if you nail this difference. So the cycle becomes 5 back blows, then 5 abdominal thrusts. Okay, but what's the worst case scenario? What if the choking interventions don't work and the child becomes unconscious? This is where your training really kicks in. You have to switch gears immediately. You stop the choking first aid, and you go straight into CPR. Now, this is so important because pediatric CPR starts differently than adult CPR. You have to start with 5 initial rescue breaths, 5 of them, right away. And you might be asking, why? Well, for kids, cardiac arrest is almost always because of a breathing problem first. So getting that oxygen into their lungs is priority number 1. Okay, after you've done those first 5 breaths, you get into the main rhythm, and this is the magic number you need to remember for your demo. It's 30 chest compressions, followed by 2 breaths, 30 to 2. Just drill that into your brain. Doing that cycle correctly and smoothly, that's what makes all the difference.
So, how fast should you be going? You're aiming for a beat of about 100 to 120 compressions a minute. You know the song, Stayin' Alive? Get that beat in your head. Stayin' Alive. That's the perfect tempo. If you can keep that rhythm going during your assessment, you'll be golden. Okay, let's tackle our last big practical topic, anaphylaxis. We're talking about a massive, life-threatening allergic reaction here. So what's Paul looking for? Two things. Can you spot it fast? And can you act decisively? Speed is everything.
You have got to know these signs inside and out. Remember your ABCs, airway, breathing, circulation? Well, anaphylaxis can attack all three, and that's why it's such a huge emergency. So you're looking for that scary swelling around the mouth and face. You're listening for wheezing or any trouble breathing. And you're looking for skin stuff, like those red, blotchy hives. You see those severe signs, you have to act. No hesitation. So what does acting actually mean? What are the steps? Number 1, if there's an adrenaline auto-injector, like an EpiPen, you use it immediately. Number 2, call 999. Do it right away. Then, while you're waiting, if you can safely remove whatever caused the reaction, like a bee sting, do it. Get the child to lie down flat and pop their legs up. That helps with their circulation. And just be ready. You might need to give a second injection in about 5 to 15 minutes if things aren't getting better.
Okay, listen up, because this is a massive point for your practical assessment. You're going to demonstrate using an auto-injector, yes, but it will 100% be a training device. It's a dummy. No needle, no medicine, nothing. This is a non-negotiable safety rule. So get comfortable with that trainer pen, because that's what you'll be using to show your stuff. All right, let's wrap this all up with a quick cheat sheet. For a head or spinal injury, think immobilize. That's your job. Hold that head and neck still. For severe choking, it's all about the thrusts. Just remember, it's chest thrusts for an infant and abdominal thrusts for a child. And for anaphylaxis, your first most important move is to inject with that auto-injector. If you can nail those 3 actions, you're in a great spot. Look, you've done the hard part. You went through the online course, you put in the time, and we've just run through all the key skills again. You know this stuff. You have the skills. Now you just have to go and show them what you've got. So walk into that assessment with Paul feeling good, feeling confident. Seriously, you've got this. You are ready.